It is just a huge honor for me today to be podcast interviewing Dr. Monica Casadei, who graduated with honors at the University of Bologna in medicine and surgery in 1982. She works as a general dentist since 1983 and in private practice in Ravenna, Italy, with her partner and husband of 30 years, Dr. Massimo Testi. In 1984, she obtained the Postgraduate Edgewise with Professor Ahorn in the Tweed technique. She attended Professor Langlade's course for Ricketts technique. She attended the Donau University from 98 to 2004, obtaining the master's degree with Professor Sato in orthodontics, orthodontic treatment of functional patients and dysfunctional. In the gnathological field, she attended the course of Professor C. Avril, of Professor Alain Landry, then followed the postgraduate in gnathology at the University of Vienna with Professor Slavicek in 1996. Ordinary member of the Italian Society of Orthodontics, IBO member, founding member of A.I.G, Italian Gnatological Association, in which she covered the advisor charge from 2008 to 2016. She's a member of the International Academy of Advanced Interdisciplinary Dentistry. She translated the books of Professor Sato, Orthodontic Treatment of Malocclusions According to Craniofacial Dynamics, and Mew, Orthodontic Treatment with the Multi-Loop Arc. Since Mew is MEAW. Since 2016, she has been part of the teaching staff of the basic core curriculum of VICED Foundation of Professor Rudolf Slavicek. She teaches for the VICED Foundation a postgraduate clinical course of orthodontics in Vienna, in English 3 years under the patronage of the University of Vienna as the course director, and having as guest lecturer Professor Sato. She teaches for VICED Foundation a postgraduate clinical course of orthodontics in Poznan, Poland. She proposed yearly basic and clinical course of orthodontics throughout Italy, applying orthodontical and gnathological concepts. It is just a huge honor for you to come on the show today.
Are you sure it is my curricula?
Yes, I had to laugh when you said you teach at the University of Vienna, because I remember the first time I lectured in Vienna.
Yes.
When I stayed at the hotel, you know, when you live in America, people are always having plumbers come to their house or something wrong with the toilet, or, you know, there's always something wrong. And I checked into the hotel in Vienna with, I think, were you there with me, Ryan?
No, that was Eric in Vienna.
Eric and anyone else? Just Eric. And I had never seen that complex plumbing in the bathroom and the shower. I felt like I was on the Star Wars ship. I mean, when I looked at the plumbing in Vienna, I thought, my gosh, I think they're the number one in the world in plumbing. And then I talked to the guy, because it was a very old hotel, and he said he thought that plumbing would last another 100 years.
Do you remember the name of the hotel? Because it's Hotel Atlanta is a very old hotel close to the Vienna University. And when I went for the first time 30 years ago, I normally stay in this hotel, and now that I come back for teaching in the same university is completely renovated, but the hotel is always the same. The change is only the lift, you know.
Yeah.
But the smell is the same.
So, gosh, there's so many things I want to. I was asked by several orthodontists on OrthoTown to try to get you on the program because of your MEAW, MEAW orthodontic treatment with the multi-loop arc. There's so many things I want to talk about. What did you want to talk about for us? You want to share your experience with the gnatological school of Professor Slavicek and the orthodontic teachings of Professor Sato?
Yes, I want to start just to call briefly my story. The beginning, because it's funny, it's a little bit funny how it starts everything. I started my dentistry career as a general dentist, but immediately I followed the Professor Slavicek courses in Vienna about occlusion and function. And you know, Rudolf Slavicek is the father of the modern gnatology. And in Europe is the Pope of the dentistry, and follow his concept was why reasonable easy for me. in prosthodontic dentistry, but to apply these ideas in orthodontics was really hard. And I can say that I felt completely in love with orthodontic when I first met Professor Sato in 1995, so at least 11 years after my graduation. And it was funny because Professor Slavicek called me around the middle of August in the office and told me that I must attend the course of Professor Sato. And if you know a little bit the Italian, you can immediately understand that I wasn't really joyful of that news, because the 15th of August in Italy is almost a holiday because of the summer holiday. And so, but if you know Professor Slavicek is a person that you can, a person to whom you cannot say easy no. No thanks, no, I don't agree. So I remember also that during the call, he said, listen, Monica, listen to me. He treats severe class 2 high-angle cases, skeletal open bite, without a premolar extraction, without surgery, without high pull traction, extruding the upper molar. So if you have such an affirmation from an orthodontist, was madness, no? In the case of class 2 high angle, thinking to extrude the upper molar. But I believe so much in my mentor, because he always taught me very important things, very nice approach. So I did the course. I believe so much, and I believe I did the course, and I can say that my professional life is totally changed. It's totally changed because finally this orthodontic approach was very much in tune with the gnathological concept that Slavicek taught, and I never had and I never found a technique or rather a diagnosis, an orthodontic diagnosis that fits so perfectly with his gnathology concept. That's why. So when I arrived in Vienna, I immediately noticed that there are only a few participants attending the course, probably both for the date, of course, and because at that time in 1995, Professor Sato was not so well known outside of Japan. And he was at the time the director of the orthodontic department of the Kanagawa Dental College in Yokosuka. That is a big college close to Tokyo. But in Europe and abroad, it was not very well known. And so you have also to think that in 1995 there were no digital device, no PowerPoint, no digital camera. So a professor brought from Japan, so many kilometers, a long distance, brought from Japan trunks of slides for supporting his lessons and for showing his cases. And he was helped of course, of his loyal Japanese students. And he began, but the wonderful thing is that he began to enlighten us with his theory on the causes of malocclusion, because till now, if you know, we don't really have the causes of malocclusion. We spoke about we speak about genetics, but we don't really treat, for me, the causes, but the facts. Okay, so he spoke about his theory of the causes of malocclusion, and speak about also the big influence that the inclination for example, of the occlusal plane have on the development of the class 3 malocclusion or class 2 malocclusion. Then I prepared just a little presentation to show the concept that is, I think, it's easier to explain. And it started from evolution, so very far, and it started to speak about, to describe all the movement of the bone, sphenoidoccipital synchondrosis, and the growth of the temporal bone. That were bone that I have, of course, studied in anatomy years before, but I have studied not in a functional way. For me, it's just bone, full stop. Okay, so and his focus is to explain how everything, especially the growth of the visceral cranium, was strongly related to this to the function of the masticatory organ, and so he started he began to show us his clinical cases that were very ugly cases with this diagnostic approach. And in particular, he showed us how he used the mu. The mu is only a tool, okay? Is just a multi-loop edgewise arch wire that Professor Kim before used in different way. But with this arch, and with the use of the elastic, you can have a really so big change in the inclination of the occlusal plane, or extruding the teeth. For example, in low angle cases, the problem is always that we have to intrude, for the deep bite, to intrude normally the frontal teeth, and then after some years, everything come back again like before. Instead of using this kind of wire and the elastic, we have, for example, the extrusion of the lateral side of the buccal, so of the premolar and the molar, and it is stable in the time. And yes, and the treatment time and other things is nice is that the treatment time is shorter. In 1 year, 1.5 years, we can finish all very severe cases. Mostly cases are surgical or borderline, and it is possible to treat or to give to the people who doesn't want to change the face, just want to have a functional occlusion. You can provide a functional occlusion without to go to force to go to surgery. And another things is that impressioned me. It's that he showed follow-up of 10 years. Normally, when you go to the course, you see 1 year, 1.5 years, and that's all. But when you see the follow-up of 10 years, 7 years, 5 years, I think that it is very. I think that you can believe, no? You can believe in what you are learning. And as you told, I attended several courses before it, Tweed, Langlade, Ricketts course, straight wire, and I am a person that when I come back home from a course, I immediately change everything, okay? I want to, if I go to a course, it means that I have something to learn, to change in my practice. So I come home, my office, and I make a revolutionary, and my assistant also is not, often didn't agree, but yeah, I want to change if there is something that doesn't work, but every time I was so frustrated because it is so difficult, the learning curve, and when you see that some cases stay and are stable and some not, and you don't know why are not stable, and so you cannot learn from the failure. And for me, I was really, I was really frustrated. I want to stop to be an orthodontist and make only prosthodontic treatment and so on. And but yes, after this, really, I have after the course of Professor Sato, I have really changed a lot and if I don't want to say that now everything is perfect and I have no mistake and all my cases are so beautiful, but if I saw some relapse or something wrong, and if I take, if I make, how can I say, if I go back, looking what's happened during the treatment, I found what I did wrong, okay, and this is yes, and so you can accept and you can learn, because you can fail, but you can also how can I say, do again, or what I want to say, for example, to the young colleague, it is that normally what is taught in the university, it's that we look to the development and the treatment of the malocclusion, especially focus on the sagittal way. Okay, we want to treat the class 3 and class 2, just looking the moving sagittal in the sagittal way, the teeth. So there is space now, so we have to extract the teeth. Instead of Professor Sato concept is more focus on the vertical treatment, and for example, for us, the guided dental arch is not the lower that will indeed force us to extract the teeth, but the upper one, for example, because the upper one you can, by expanding and changing, the occlusal plane and increasing the vertical dimension, so the lower arch can adapt. So the difference, the big difference, for example, in the treatment of class 2 is that we move the mandible, okay? We move the mandible like normally it is done in functional treatment during the growth. But we move, if you want to move the mandible, and here is important to have a gnathological concept and to have instrument to measure. You cannot move forward the mandible as you want. Okay, so we use, for example, the condylography. The condylography is the tracing of the sagittal condylar path of the eminentia, and so you can. It is like a bussola. I don't know in English the name of the bussola, with the north, the south, east, and west. if you make some examination, you can know where you are and where you want to go and how much, and so you can measure, okay? And in class 2, believe me that I normally do use the condylography also in the children, and in class 2 you find always, also if you don't have still symptoms or signs, but you find compression. Light compression or worse compression, but anyway, always compression in the TMJ. So moving and treated the class 2, moving a little bit the mandible forward, instead to distalize or to remove the premolar, is really healthy for the patient. Because however, if you remove the 4 premolar, sometimes with very not big crowding, you provide a steepness frontal teeth. Okay, come si dice, reduce the transversal size of the arch. Okay, so the tongue that is so important have less space, and also you have less posterior support of the teeth. Okay, so I think that this is why I see normally, not immediately, fortunately for the dentist, but I saw some years after orthodontic treatment with the extraction of the premolar that they became, not all, but they became dysfunctional patients. And you know, I think why? Because now, respect to some years ago, all the people is become a clencher, okay? Because of stress, because of the children are always on the digital device. They don't go to make sport, and the clencher I think also in America, the bruxist increase a lot. And so if you have not good occlusion, compared to some years ago, 30, 40 years ago, now just a little lack of support, just a little too close occlusion provides this inconvenience. I don't know if you agree with me. And after learning, after having seen all these, how can I say, good things, no? I followed the Professor Sato for 6 years. Of course, it's not 6 years really, because I go every 3 months for 3-4 years in Vienna, for 3-4 days in Vienna to follow the lecture, and we can bring also the patient, and so with his supervision we can treat the patient. And from Italy it's a little bit difficult, so I bring the slide until PowerPoint come, and I have all the information how to go on with the treatment. And so I started, and I was so happy to learn this, that I felt the desire to teach the other colleague this new method, no? This new method of making not only from the technical point of view, but especially from the method of making the diagnosis of malocclusion. And Professor Sato also supported me this choice, and he shared his material with me. And I have at the time I have 3 children too, so also my husband supported me because otherwise I cannot start to teach. And I have my first course in Salerno, in the south of Italy, near Amalfi, so in an amazing place also. And after the course, I receive a call. One day, I receive another call. Can you imagine? The story starts with a call from Slavicek. And then after 10 years maybe, I received a call. I was on my motorcycle with helmet, so I was thinking I have to answer or not, or I have to answer. But I am, you know, the woman are too curious, no? So I stopped the motorcycle and I answered to a call, and it was my colleague that work in the ANDI. ANDI in Italy is Italian Association, National Association of Dentistry, and he was one who followed my course, and he invited me to speak for one day in Gifoni. Gifoni is a very nice place in the south of Italy where take place the festival. How can I say, the Children Film Festival every year, okay? And he was a very amazing place. But in that time, unconsciously, I answer yes. I answer yes, but I have never spoken in English. I have no, not in English. I have never spoken in public, and I was very shy. And you can believe I many times I regret having accepted. So I spend all my summertime scanning a slide because I want to transfer all the best that to the audience, all the best that I have learned, and I never thank enough my colleague that for inviting me, because I think that I will never. I don't, at the time I don't think really to teach, and so now I teach in Italy. I have a basic course. I work in my office. And in the weekend I teach. For example, in a basic course that is 8 days, divided in 4 times in Milano, Turin, Bologna, Rimini, Rome, Bari, and Catania. So all the parts, and also abroad. Professor Sato, he was 10 years older than me, so it's 72, and he passed me, you know, he passed the compito, the duty, no, to have this clinical course in Vienna with the student and with the patient and so on. So now we have a clinical course in Vienna, as you said before, and in May I will start in Polonia, in Poznań, and in Varsavia too, and so. And I am really very happy because I didn't expect that I would like teaching so much. And but now the problem is that this year is very intensive, because I have to take care of the office, I have to take care of the teaching time. I have no time for myself, no time for my health, no time for my friends, no time for my husband, and it is a little bit dangerous. So I plan I am teaching now to a consultant that is a young dentist, but I like how he is. He very, very affamato, angry to understand and to learn what I know. And so I hope that next year to have much more time to concentrate it on the teaching and just to have less days, maybe only 2 if it's possible, if my husband agrees, only 2 days in the office and have much more time for my life because I am 62 and I spend really the last 10 years too much concentrated into the work, okay? Because I like the work, but you know, the life is done, you have to be, yes, everything must be well distributed, no? The time for you, for the health, for the friends, and now I am a little bit, you know, only in one way. And so that's all. I think that to be an orthodontist and treat the patient in this way is really marvelous because I feel that I am a doctor, okay? I am not only an allineatore, come si dice, alignment of teeth, but I am really a doctor because to take out of my story, maybe always answer the phone because there could be an opportunity to be silent. And yes, this is briefly all my story. Okay.
It's a beautiful story. What I'm very interested in is before the internet, many countries practiced dentistry independently, and they didn't really share a lot of information. And now that you have the internet, and now that it's very low cost to fly around the world, it's really interesting to point out discrepancy. How do great civilizations do dentistry differently? For instance, do you agree that the Americans do a lot more orthodontic surgery than, say, the Taiwanese, the Koreans, people?
Of course not. Of course not. I don't agree.
You don't agree?
Yeah, no, I don't agree. I agree. For me, the surgical treatment must be done if the patient wants to change really the face, or if you have a very, very severe malocclusion that you cannot provide to the patient a functional occlusion. Okay, you don't have to stay in the middle. You don't have to provide make only a camouflage and just have not a functional occlusion. But if you are able to provide a functional occlusion, and the patient that came to me probably because they know they come because they don't want to go to surgery. Okay, sometimes they have a long face. And but they accept it, okay. And also, if not, I think why you don't provide a functional occlusion without surgery, and then if you want to migliorare, to improve your profile, your face, to make a surgery is a light surgery. For example, the chin surgery or something very not so so big like now. For me now it's a little abusato, come si dice? Is a little bit abused the surgery. Okay, for me, for my smile. Also in Italy, the same. In Italy, a lot of dentists look to the patient if he has some little crowding or some little chin, a little bit back, so immediately go to surgery. But the patient, not all the patients, fortunately accept, and
So you feel the orthodontic surgery rates are pretty much the same from the United States to Italy to Korea to Japan? The
is
same
the same.
percentage of cases as the same common, I mean, used about the same amount?
No, I think that in ASEAN, I think are less.
You think Italy it's less?
No, in ASEAN country, I don't know. I think they use less surgery.
Yeah,
I don't
that
know because it depends. Because I follow Chris Chang, and other guys very very clever that they are able using other device like the screw in the buccal self. They are able to jump the surgery to treat severe class 3 case. And I also use sometimes the mu, because the mu, the things that is not, it's difficult to accept for the patient. It is that they have to wearing the elastic, okay? And it is a condition sine qua non. If you don't wear the elastics, it doesn't work. It becomes worse, the malocclusion. But in the future, next year, when I have more time, I want to keep the concept, but I want slightly to change the mechanics, okay? Because mu is important for something, for some step, but some other step you can use the new device that we have, like the screw in the buccal self, or the screw in the zygomatic arch, and why not? Why not? It's marvelous. I saw some cases, a lot of cases of Chris Chang. I download all the cases from the Beethoven, no? From YouTube. And yes, I have a lot of idea when I treat my patient from his cases. And I try to mix,
When I got out of school 30 years ago in 1987, it seemed like about half the cases were treated with 4 bicuspid extraction.
Yeah.
Now that I've been out 30 years, it's fallen in half to about a quarter of cases that I see and my colleagues see. But you haven't done a 4 bicuspid extraction in 20 years.
Yeah.
Why the discrepancy? I like to find discrepancies.
I can show if you want after in my presentation, because if you remove the premolar, it's because you think that the causes is in the front. Okay, you see the crowding in the front. Okay, so you remove the teeth in the front. Okay, but in reality, you are the crowding because there is a mesialization, okay, of the teeth. If you look at the photo of the patient, you can see to the cast of the patient, you can see that all the teeth in the lateral side are mesialized. So if you remove, instead of the premolar, if you remove the wisdom teeth in an early stage, so you can also prevent some problem, no, with the nerve alveolaris inferior. So if you remove the wisdom teeth, you have a lot of space. But the problem is how to uprighting the teeth. How to uprighting the teeth, and also faster. And so now you can use the screw with the buccal self or the mu. Okay, and if you are uprighting the teeth, if you apply, for example, 15 degrees of uprighting, you can have 4 millimeter and half in each side. So with 9 millimeter, you can really correct all the crowding. But the problem is, sometimes when you upright the teeth, unfortunately, you have also an extrusion, okay? And for example, in class 2 high angle, it is not really a good thing to have this extrusion. But if you use a new, with a tip-back band, with elastic, you are able to upright the teeth and to maintain, not increase the extrusion, but to maintain the same level, or also to increase. So this is the fantastic things that can do with this kind of arch and with elastic, of course. And so it's not necessary. It's not necessary because you say, why wisdom teeth instead of premolar? Because sometimes if the problem is in the posterior area, if you remove the premolar, first of all, the treatment, the mechanics is also a little bit difficult, because you have to move the canine, and all the teeth are very straight with the root, and not only incline the crown like several times I saw, and the problem is not after some years because I extracted before the premolar, and after some years there is a relapse. Sometimes I have crowding and I have space. So why?
So when you lecture in Poland and Russia, what language do you lecture in when you're in Poland and Russia?
In English.
So how many languages do you speak?
Italian and English.
But and what percent of the dentists in Poland can understand a lecture in English? Same in Russia.
Yes. No, in Russia they have the translator.
Okay, Russia translator.
In Poland, all the people in Poland they understand English. Yes.
So in Russia, you will lecture in Italian and then have a translator translate it to Russian.
Yeah, no, I prefer to have lecture in English, because I hope to improve. No, if I speak in Italian, I never improve my English. So I try to improve always my English. So I want to be out of my comfort zone, and I speak in English.
Well, I tip my hat to you. I've lectured in Italy several times, and I can't speak a word of Italian. I'm so impressed when dentists can lecture in a separate language in their mother tongue. To me, that is just unbelievable. One of the biggest things that's come out since I graduated, there was no such thing as Invisalign or clear aligners. And now it is a major company around the world. They're selling Invisalign as much as they are in Asia, Europe, America. What are your thoughts on Invisalign?
Why you asked me this question?
Because it's Dentistry Uncensored, and I don't want to talk about anything anyone agrees on. I think the show is successful.
Because I must be, come si dice, cattiva. I must be bad woman. If you know my answer. If I speak until now about function, it is impossible to treat patients functionally only with Invisalign. You can, yes, there are very huge colleagues that treat several cases with a lot of crowding with the Invisalign, but you cannot have the control because Another things that we take into account when we finish, in the finishing of the cases, for example, is not to have just the class 1 looking from the vestibular part, but the stability of the cases is when you have the palatal cusp, okay, of the upper teeth in the fossa. And so it's very difficult if you cannot work with the torque, with the extrusion to achieve this. Now I want to see how will be the development of the sure smile. You know, sure smile is a machine that you make a dental scan. For example, in the finishing, for the finishing, you can make a dental scan of the palatal part, and you can send the file, and you can ask to put all these little movements, and they provide you a wire, I think in TMC, beta titanium, and there is a robot who bends the wire for you for the finishing. And in 2 months you can have this. And I would like to try also next year a lot of things that I have to do the next year, because the finishing is important. For example, Professor Sato and me, we don't use fixed retention. If you use fixed retention, especially, sometimes I use in the lower arch, but never in the upper arch. Because if you use a fixed retention, it means that the case is not stable. Otherwise, you don't need to use. Okay, he use a removable appliance for 9 months, 3 months after day and night, and 6 months only during the night, and then nothing. Okay, then stay without anything, and because you have the palatal cusp, the big palatal cusp of the 6 of the premolar, if you fix it very well in the fossa, it's impossible that you can that the case is not stable. Okay, so I use Invisalign. But for very little correction. For example, if I have a little, some little rotation, and the patient doesn't want, some patient are very crazy because I like so much when the teeth are not so well aligned. In fact, when I work in removable prosthodontic, I put the teeth not well aligned, but because the patient, I don't want that the people say, oh, you have a removable prosthesis, okay? And in orthodontic fields, instead we have to align everything. But some patients want everything that must be aligned, and so in such cases I use Invisalign, okay, but not normally.
I want to ask about differences in Italy as opposed to like the United States. Like, for instance, does Italy use water fluoridation? Do they adjust the fluoride? Does Italy adjust the fluoride concentration in its drinking water to reduce decay? Do they use water fluoridation?
Water
fluoridation. That's where you
water fluoridation. Yes, no, we haven't water fluoridation, because in Italy there is in some regions, like in Veneto, in the north of Italy, there is a lot of fluor. So sometimes it is the patient have a problem because they have too much fluor. So they have enamel problem and so on. So we don't use. I give like a therapy with like a drug, like to the children, but not in the water that you can have from the rubinetto tub.
I want to ask you another subject. Some people in the United States always say that some countries in Europe have banned amalgam because of mercury toxicity. Are you aware of any countries in Europe that have banned the use of a
Yeah.
silver filling?
Yes, no, nobody use never. Nobody use amalgam.
But
No.
has any governments made it illegal? Have any governments anywhere in Italy or Scandinavia or Germany, Denmark, Sweden, Switzerland, has any governments passed a law that said you cannot use it? Or are dentists just not using it because they don't want to, or has there been an actual law that says it's illegal to use it?
To this to this answer, to this question, I don't know really if there is a law, okay? But I think yes, because for example, when we have to remove the amalgam, we have to write in a book everything, and there is a special company who come si dice raccogliere collect this material. So, but I am not sure. I am not really sure if it is really a law written. Okay. I can.
Yeah, I just want to say is I just want to say that a lot of Americans always say that it's illegal in some advanced countries in Europe, and I've not been able to chase down the lead. I have lectured all over Europe. I've done podcasts all over Europe. A couple countries have recommended that it not be used in pregnant women, but I cannot find any dentist to confirm that there's a law passed to ban the use. And
Yes,
so
I don't know.
So when you're at your local study club and someone tells you what they're doing in Europe, ask them if they've actually been there and if they can give you a name and an email of a dentist that can verify that. And then email it to me, howard@dentaltown.com, because I don't believe you. In Italy, you have 60 million people and 60,000 dentists. So you have a dentist for every 1,000 people. Does that make dentistry? I mean, that seems like a lot of dentists. And a lot of the United States is about one dentist for every 1,850 people, or almost one in 2,000. Do you think there's too many dentists in Italy, or is dentistry still a good business even though there's one for every 1,000 people?
No, it's not never a good business. So we are lucky because now we are very specialized in these fields. Okay, so I have patients from all over. I have patients from Poland, from Cracovia, from Dublin, and a lot of colleagues sent to me. Of course, I have only difficult cases, but in Italy, for example, started to grow the center of dentists which work with a very low price because we have also Croatia close to us that make a lot of work a lot in marketing to try to keep our patients. So I think that the future is not good for the dentist. In fact, I have three children now. Three children is now two are studying in one is studying in Sydney in physiotherapy, and the other the second one, the son, work in business account, and the oldest one is close to me, Ariana. She's graduated in economy and marketing. No no one of my children I push to be dentist, because I don't believe in the future in Italy the profession of the dentist, I think will be worse.
Italy is part of the EU, the European Union. So that means you can practice in what is it? 28 different member countries. So you could take your dental license and practice in Belgium, Bulgaria, Croatia, Czech Republic, Denmark, Germany, Estonia, Greece, Spain, France, Ireland, Italy, Cyprus, Latvia, Lithuania, Luxembourg, Hungary, Malta, the Netherlands, Austria, Poland, Portugal.
So
Romania.
how many I can metastase? I can put a metastasis everywhere.
So is that true though? So could any dentist in any of those other countries, like from a dentist from any country on that list, come to Italy and practice?
Yes, there is some, but mostly Italian go abroad. For example, a lot of my colleagues work in Spain or in London, but we don't have a dentist from the other country, from Romania or from no. It is easier that Italian goes abroad.
So more people from Italy go to other countries than other countries come there.
Yeah. Yes.
And I don't ever want to talk politics, and we talked for the whole hour, but I just want to ask one political question, and I hope I hope it's not offensive. Over here, we always hear about Brexit, the United Kingdom leaving the EU with Brexit. Do you think that was, is that the beginning? Is that going to be a trend, or do you think the United Kingdom was just very unique? It's an island and it's just a one country deal. Or do you think 10 years from now, other countries will have left the EU?
No, I think that we must be unit. We must be unit. Europe must be unit. I think that the Brexit is not a good chance, a good choice for Great Britain. But I don't follow too much political, because in Italy, I don't know in America, but in Italy, when you watch on the television, they spoke about some events for months, okay? And so really, when I went to Australia in Sydney, there is 2 minutes of political information, and all the other news, every good news, and to see the television, the political on the television in Italy is very, very boring. But anyway, I think that Europe must be unit, okay? Must stay unit, okay? And I don't think that, yes, the Brexit is a good choice that Great Britain have done, okay?
Well, I have to thank you in that my mom is very Catholic, and her two oldest daughters are Catholic nuns, and probably one of the greatest gifts I ever gave to my mother was I sent her on a church group to Rome, and I literally thought she wasn't going to come back. She thinks Rome and Jerusalem are the 2 greatest cities in the world, and oh my gosh!
Yeah.
And I love Rome too.
Me too.
Yeah, I mean the history. I mean, people don't like. I'm in Phoenix, Arizona. I'm in the middle of the desert, so it basically before the air conditioner, there was no big cities out here. There's a lot of Indians, reservations, all that. But so this city exploded after the invention of the air conditioner about 1940. So in my city, the oldest building I can find is maybe 80 years old. And then you go to Rome and you see Colosseums
Yeah,
that are
yeah,
2,000 years old in the catacombs. And
yeah.
I'm telling people that
It's incredible.
it doesn't matter if you're Catholic or not, or Christian or not.
Yeah,
It is one of the well, Rome was the first city that passed 1 million in population.
yeah,
And it was
yeah.
just, my God, what an empire, what a history. In fact, when you go to the FD, what is it, the FDI meeting in Cologne, Germany, the IDS meeting in Cologne, Germany,
Mm-hmm. Mm-hmm.
Cologne was the farthest German outreach of the Roman Empire. So even Cologne still has a wall around it. And I mean, oh
Yeah,
my gosh, I could go to it would take you a month to go to every museum you want to see
yeah.
in Rome.
And also in Florence. Rome is special because now I don't know when you went to be in Rome, because now it is a little bit changed, because it is beautiful also the sound of the dialect of the Romans, okay? But now in the center there is only Pakistan. Only if you go to the market, it's completely full of Asian people, and so you have, of course, you have the monument and Fontana di Trevi. And when I went, I love so much Piazza Navona, and I sit down in that restaurant that is a little expensive, but doesn't matter, because I appreciate so to see this big square. And I love Rome too. I love Rome too. And I never, when I go out from Roma Termini, from the, it's like if I take an antidepressive drugs, okay? I feel full of energy. I don't know why. It's the same as in Naples. Naples is a little bit dangerous. You have to be, but also Naples is so big fashion.
And the other thing I thought,
No.
last question, when you love food like I do, take
Yeah.
Mexican food. Mexican
Yeah.
food is so different in Mexico than it is in the United States, and even
Yeah.
even the states that border Mexico. In Texas they call it Tex-Mex. I think the best Mexican food is in New Mexico. Arizona Mexican food is very different than New Mexico food. And when you get into southern Mexico, all of the Mexican food items that Americans like, they don't even know what you're talking about. But I'll tell you what, it was in Venice of all places with me and Eric that there's a lot of Italians in the United States, especially in the East Coast, like New York and New Jersey. I tell people there's no Italian food in America. You think there is, but there's
Yes.
not. Because
It's normal.
when we went to Venice, I mean that lasagna, all the dishes. I mean it was at a different level of amazement. And I tell
Yes, it is normal. It is normal. If you want the food, Italian food, you have to go to eat in Italy, of course.
I believed before I went to Italy that there are so many Italians and Italian heritage in New York City
Yes,
that New York
yes,
City you could find an
yeah,
authentic Italian restaurant. But I assure everyone
yeah,
listening, there is
yeah.
not one Italian restaurant in all the United States. You can't eat Italian food by
No,
a
because
second, third, fourth generation Italian. And the
yeah,
Italian food, especially in Venice, was at a
yeah.
different level.
Yes, probably also because there is a second generation, and also because the products is not really the same. Because
No.
the Parmigiano Reggiano, for example, now in abroad you can find Parmesan. Parmesan is not the same. The taste is completely different. Or the mozzarella, okay, you can eat. You have to eat in Italy, and in America you have to eat American food. I don't know which is the American food, but
Well,
and you know,
it was a huge honor for you. We went over our hour, so they're probably sitting in the parking lot waiting and ready to go into work. But I just want to tell you that it's 9 o'clock in the morning on a Monday here. What time is it in Italy?
Now it's 6 in the afternoon of
6
Monday.
p.m. So I just want to tell you, so you're 9 hours ahead. Thank you so much for coming on the show today. I was so excited when you accepted my invitation. You're so informative. Thank you so much for coming on today and talking to everybody. And I hope you go out and have yourself a very nice Italian dinner tonight.
Yes, and Howard, please remember that if you want to come in Italy, you can pass to Ravenna. You can visit me, because also Ravenna was the capital of the Byzantine Empire of Occident, and we have so beautiful mosaics. It's a very little city. You can go by bicycle, and it's very, very like a jewel. Okay.
Didn't Mozart play in Vienna? Did Mozart, Wolfgang Amadeus Mozart, didn't he play in Vienna?
Yes, of course. Yes. You can hear the music in all the streets, but especially in Salzburg, because he was born in Vienna, but he lived in Salzburg.
Yes. Okay. Yes. Well, thank you very much for coming on the show. I hope I get to have dinner with you in Italy someday.